Hello, welcome to I'm Not a Doctor, but my name is Nicole, and I am trying to give you all of the information that I think doctors should give you, but they don't. And most of it applies just to my real life because I have so much experience due to chronic illnesses. So, figure out how you can apply it to your life, but I cannot legally give you any kind of true diagnoses or uh, I don't know, ways to heal yourself other than mere suggestions based on what's happened to me in my life. And one of the things that I had to do recently was change insurance. My new insurance required me to have a primary care physician selected. What I didn't understand was that there's only so many doctors that are considered primary care physicians within that network's grouping for a certain year. So when I went to sign up for the insurance in 2025, I had to assign a primary care physician. I did all kinds of research, found one that I thought would suit my needs. I also prefer a DO over an MD and like to go the internal medicine route because I have an opportunity to have somebody who looks at the body a little bit more holistically, then that's what I prefer. And the doctor that I picked in 2025 was no longer applicable in 2026. So my insurance was telling me I needed to pick a primary care physician, which I already had, and I didn't understand. And so then I picked a new primary care physician for 2026 after again doing extensive research and called the office and they said, "Well, even though she is listed, she's not actually accepting new patients." I cannot tell you how insanely frustrated I am about the requirement and then being limited and then having to do this basically 3 times. I don't understand why they require you to put one in initially if that doctor is not gonna be on the good list when your insurance is actually available to you. So the whole picking a primary care physician has been quite the dilemma and has worn me down to picking one that is, close enough and is with, a network that is very large and at an office where they'll do blood draw and other things, so I don't have to travel to do that either. I was concerned about using a new health system and the fact that then I would have all of my records in an old health system, and I'm in Michigan. Everything that I do has been in the Beaumont Corewell system for many, many years, except for some strays in the Henry Ford system. This new doctor is in Trinity Health, and I was like, oh man, they're not going to be able to see my records. I did all this work of printing everything out for him, um, trying to make my appointment as efficient as possible, also get as much out of it as I could. And then turns out, yeah, he could see it. They could actually see all of my stuff in my chart from the other hospital. I did, before I went, link my charts, but that appeared to be from my side just a user experience situation where you can log in and see the Trinity Health and the Corewell Health on the same page, and then you select one, and then you still kind of log into those separately. I didn't see how they were combining my records. Therefore, my chart in the back end and what the doctors see is definitely different than what we see because I was prepared and had things actually printed, and he was fine without, like, he saw everything very quickly, and I, honestly just used the ratings system within the insurance's program to after I delineated down my primary care physician choices to DOs within a certain mile radius, within a, convenient center, then used the basic star system as far as 5 stars, 4 stars. I did do a little bit of Googling just to make sure that there weren't any, like, crazy stories out there. Um, and so 3rd time's the charm. I met with him and was actually quite surprised by his intuitiveness and how quickly he learned my history and how he figured out the pointed questions to ask. I honestly was going into that appointment to establish care and to talk about one issue that I'm having. However, it's digestive related and so it's connected to everything else in my body. And he actually was concerned about the whole picture and wanted to talk about everything. And so at the end, when he asked if there was anything else, I said, no, I was just trying to establish care and address this one hiccup. And he was like, well, it's important that we talk about it all. I'm like, I agree. And my level of impressed may have also been skewed because he was like younger and good looking, which I don't think I've ever had a younger good looking doctor before. So this is interesting experience for me because he's sitting there asking me when's my last period and all these other questions. And you're like, did I did I go wrong here in picking a younger looking guy? Because now I have to talk about how irregular my pooping is with him. So anyway, doesn't seem like it's a regretful choice based on the way that he was so attentive, and I feel like the appointment did last probably 15 or 20 minutes, maybe more closer to 20. I did not feel like he was rushing me, which is great, and I did not wanna change primary care physicians because my physician's office that I typically go to is at Integrative Health. They are internal medicine. It's just that they did not take my insurance, my new insurance. They said, nope, we're not doing it. So I'd be a cash patient there. And then I'd have to go through the rigmarole of trying to submit a claim to submit that goes against my deductible. Um, when it's just not worth it. Plus, I I don't know. It seems like it's legal. Like there's going to be some sort of ramification legally if I don't have a primary care physician for this new insurance. I don't know. It's crazy in regards to how much they can control who you see, when you see them, uh, why you see them. I mean, insane. Anyway, I felt extremely vulnerable in this new position, or I guess a new position with a hot doctor, but it would have been any doctor, even if he wasn't attractive. Talking about my long health history and him bringing up various surgeries and things that I've had in the past and poking questions at why am I not seeing this doctor? Why am I doing this? Why am I doing that? And it for whatever reason felt very emotional for me. I wasn't expecting it to, and I don't know why it did because it wasn't as if he was overly compassionate. However, he did seem to recognize that this has been a struggle for me for a very long time and understands that when you have a chronic autoimmune condition and now it's been over 20 years, how it can really alter your life. And he's giving me this impression without saying those words. And I was a bit taken aback, I guess, to have it all flashed in front of my eyes in such a short period of time and talk about how my quality of life over the years has just been kind of getting through. Um, and I don't know, I guess there just was some realizations made as I had to do everything so quickly and catch him up. But I left that appointment feeling as though I did have an actionable next step. He did refer me to a specialist. He did ask what I wanted him to track or not track. Um, and it seemingly felt like just a normal doctor appointment, but there's something about it that hit me harder. And I don't know why it's so vulnerable to talk about these things with somebody new. Um, and I don't know if there's also a little bit of an embarrassment feel that comes in when somebody's questioning, why aren't you seeing this doctor? Or why aren't you doing this? Or what made you change? And why did you make that choice? And it's just a lot to kind of face in the moment and try to wrap up in this pretty picture, but it's not a pretty picture. So for me, I wanted to share today how it, going to the doctor can feel overwhelming. It can also feel like something you have to do on your checklist. It can also feel like if you're going, that means that something's going to be bad. It means that if you're bringing it up, if you're searching out something, then you're going to find something. Um, And a lot of people don't like to go to the doctor, and I don't know if that is part of it, is the emotional part, the confronting yourself in why did I wait so long for X, or why have I let X, Y, and Z happen? It's a bit jarring, especially with somebody new and having to do it all so fast. So I just want to, I guess, convey that you're not alone, and that even though I've been seeking out different doctors, had different insurances, been doing this over and over, it doesn't seem to ever necessarily get easier or better or different. In this situation, I have a seemingly good doctor who is listening, wants better, and is offering some simple solutions and is willing to look at my body holistically. And I don't think that we all get lucky with that either. And there was maybe even a part of me that felt a little bit seen by him. And it was just completely unexpected, to the point where when I left and I went home, I decompressed for a little bit. I just kind of sat on the couch watching TV, um, wanting to pat myself on the back for doing the thing I'm supposed to do and knocking it off the list, but then also grappling with the fact that it was an emotional experience, which is odd for me. I feel like a lot of the times I'm so matter of fact when I go in there, and I've got all my printouts and I've got all my stuff and I'm so prepared, and it still hit me. So, if you are in a position where you have to find a new doctor or you have to go to the doctor after a long time, I I just want to remind you that these are all feelings that are valid, feelings that only probably you're feeling. I don't think the doctor had any real true feelings about my choices. However, I can understand not wanting to admit certain things or not wanting to share certain things. Ultimately, this person is a stranger, doctor or not. And I don't necessarily have advice other than it's just hard temporarily. You'll get through it and you'll be better for it. And now on the other side, I will hopefully make other connections with other good doctors that he has recommended that can help get me into a position where I can have a better quality of life. That is my little health rant for the day, and I hope that it it brings some comfort and helps shed some light. That's what I'm here for. So, I guess that's all for now, friends. I'll see you again soon.